We will introduce our first speaker. Khamis Haji has a Master of Science in Biology and Control of African Disease Vectors. He's worked for the Zanzibar Malaria Elimination Program for the past 12 years, leading vector control efforts. He'll be representing ZAMEP, Ifakara Health Institute, and the Johns Hopkins Center for Communication Programs, presenting a PMI-funded study looking at entomological and human behavioral drivers of malaria transmission in Zanzibar. Welcome, Khamis.
Good morning. On behalf of my team, Ifakara Health Institute, Zanzibar Malaria Elimination Program, and CCP Vector Works, I am presenting the finding from the longitudinal study looking at human behavior and entomological drivers of the persistent malaria elimination in Zanzibar. Zanzibar have been using insecticide-treated nets as well as IRS since 2006, and we have noticed that a significant reduction of malaria cases since 2008, whereby malaria prevalence was found to be less than 1. Despite of high coverage of IRS as well as LLNs and other interventions like case management, there are still some areas reporting malaria cases. So this study was designed to look at the drivers that influences those persistence of malaria cases in some areas of Zanzibar. So basically, we had 3 objectives on this study. One being looking at malaria vectors, exposure of human to malaria vectors that are occurring whether inside or outside of the house. But again, we also looked at human behaviors and activities that are exposing them to malaria risk. And the third one, since we are using LLN and IRS, it was critical to look for the pyrethroid resistance so that control efforts are not compromised if resistance arises. The 6 sites were selected based on 2 criteria, one being annual prevalence, annual parasite incidence of greater than 1 per 1,000 population, but also the site should have received an IRS in 2016. So that's the criteria used to select those sites. The study was designed to collect information from 135 randomly selected households, both entomological and human behavior at different times. But the same house used for mosquito collection is the same house used for collecting human behavior information. Entomological monitoring of mosquito were collected out and indoor from 6 to 7 p.m. ELISA test was used to determine mosquito infection rate as well as human host preference for mosquitoes. But insecticide resistance testing was conducted using the WHO guidelines in the studies in 4 study sites. in order for the data collectors or research team to have insight of human behavior, household survey was conducted, complemented by structured household observation, and 20 community observations. So we had two kind of observations. We have a household observation, where data collectors sit inside or outside of the house, documenting what is going on throughout the night. But the other observation, we had to go out the community to look what they are doing and at what time. So it was like a tough hard work, because data collectors had to stay outside where people discussing, chatting, watching television, waiting for the last person to leave the discussion. So it was about midnight to morning, you are still outside. So as regard to data management, Ifakara Health Institute bioinformatic system was used to manage all information collected. It was, I can say it was good, because data collectors could not be able to cheat. As you can see that the information was collected from evening to morning. So data collectors may happen to sleep on the way. So, but by using ODK, it was difficult to cheat. Otherwise, if they use paper-based, maybe cheating would be, possible. So it's a dashboard that you can visualize the progress of the study, but also it is easy to link between vector and human behavior. Coming to results, the population access to ITN was found to be higher, 76%, although there are variation across the study sites, ranging from 69 to 94% in some areas. But coming to general ITN use in the study sites, it was found that between 55 and 60% of people sleeping under a mosquito net during the sleeping hours. But coming to access, for those with access, it was found 75 to 80% of the study population have, use the net, although there are variation in terms of sex, age, and where, in the area, But also, it was expected that net use in dry season is, a bit lower compared to to wet season. The variation is shown here. As you can see, sir. Yeah. As you can see here, there are some areas with high ITN use in dry season, in both, like this one. The ITN use is high in both season, dry and wet season. But there are some others that are in low use. Some community members, they pointed out that during the hot season, some people, they are not very much using the nets. As this quote, during the hot season, everything is hot, even the net itself. So if you are covered with a net, you'll be on fire. Coming to mosquito collection or malaria vectors collection, mosquitoes were collected using the double net trap. A double net trap, and a total of 289 mosquitoes were collected, of which 70%, about 70% were outdoors. Again, Anopheles gambi, Anopheles arabiensis were found to be principal malaria vectors. The result is more or less the same with what is shown in routine collection of malaria vectors in Zanzibar Malaria Elimination Program. But no sporozoid mosquitoes were collected. This is a blood meal, source of blood meal from mosquitoes. You can see here, human blood is most preferred, I can say, most preferred blood compared to others. However, if you compare, if you combine the bovine and ovine, the group becomes the largest part. But since we have a significant number of mosquitoes taking blood meal from humans, so this is indication of a transmission in the community if there are, parasites on human body. This is about observation, human nighttime distribution of people. We looked at what time do people are away from their home. So you can see from early times of the night, most people are whether they are either they are out or away of their homes, and this posing the risk of malaria transmission, especially for outdoor biting mosquitoes. It's the same, more or less the same between dry and wet season. As the early time of the night, most people are either out or away from their homes. And if you can see mosquito bites, in rainy season, mosquito bites is at higher compared to dry season. In here, the average bite is reached 0.15 bites during the rainy season, while in dry season the bites went below 0.005. So this is a human exposure to mosquito bite, and you can see that there is a significant difference between the dry and wet season. Although the indoor biting is at higher side on both sides, but what we can say here, maybe during wet season, most people are inside of the house because of cold or rain. This again is a human exposure to mosquito bite. As you can see here, most bite is obtained inside the house, over 75%, and 25% is outside of the house. But if net coverage is, if you have a net coverage of 100%, then about 64% of the population will be protected using ITN. But still, you will have like 80% of the population not covered using ITN. just because this is this bite happens before sleeping time, and the protection of net, should be on the sleeping time. Here is where people chatting or discussing before sleeping time, and of course these are the bites that occur outside of the house, and therefore net has nothing to do with this group. The current ITN use is about 45%. So indoor games prevention with 100% use during sleeping hours compared to current use. So indoor exposure gap cannot be prevented by ITN. This is the indoor exposure gap, while people chatting and discussing or watching television inside the house. So in this case, there should be a consideration here to find means that will address this problem so that to minimize or to cut off the transmission. When we are looking at routine household activities in the study area, we found a number of activities taking place during those, night time, including household chores, resting, small business, and caring of children. This also exposes the population to mosquito bites. But when we go further, looking at those people that are outside, we found outside of their home during nighttime, we found about 15 to 30% of the population were out of their home. But males, they are at higher side, doing a number of activities, as you can see here, staying with the second wife, travel, visiting friends, family, etc. While they are away, no protection of, against mosquito bites. So, as we can see there, that a female coat, when you are outside, or you will really can't wear the bed nets. So travel and migration is becoming a challenge to malaria elimination in Zanzibar, as most of the cases are reported with the travel history. However, in some areas, village leaders have put mechanism to address the problem by instructing all those coming from outside the area to get tested, and if found positive, to be treated accordingly. So this at least will minimize transmission to other people. As we are using LLN, IRS, insecticide resistance testing becomes critical. This is a result of resistance testing, whereby malaria vectors were found susceptible to organophosphates like pyrimphosmethyl, bendiocab, this is carbamate, and organochlorine like DDT and malathion. But mosquito found resistant to pyrethroids, though intensity is varied across the study area. So based on what we presented, this is a key summary of findings. As we say that ITN coverage, ITN access and use was found to be at higher side, although there are some variation in some areas. Overall magnitude of exposure in vector is low, but local transmission is too low to be detected using the entomological techniques, and we found gaps for protection during indoor non-sleeping hours and while people are away of their homes. But as I said, some community members has already taken initiative to address the problem of travelers and migrants to their areas. This is our recommendation. We recommend that coverage to be maintained, especially LLN and IRS, target intervention to community that reach higher risk groups of location, when possible, provide option for protecting during when people are away or net use is not feasible. So maybe during the coming presentation where we're having like a control tool of intervention, maybe we can find some intervention that fit to address those gaps. We have to expand entomological surveillance and so based on this, any additional major intervention other than ITN should be informed by these findings. Lastly, I'd like to thank
It is working? So thank you very much, Khamis, for this very nice presentation.